Welcome to Getting Personal, a monthly podcast diving deep into the stories of the heartbeat of HR. Brought to you by Compt, a global lifestyle benefits platform where companies empower employees with benefits and rewards they'll use and appreciate, whoever and wherever they are in life. Joining me today is Jennifer Kean. She's spent her career helping founders launch and scale their businesses. She's scaled 6 companies from as little as $0 to as much as $150 million, with successful exits for 3 of those founder teams. Her focus has been in consumer products and services, everything from online gaming to beauty to pet products. And last year, she transitioned into the healthcare industry, joining Umbra Health Advocacy as their chief growth officer. Welcome, Jennifer.
Thanks for having me.
Of course. So you have built your career in startups, but you were drawn to Umbra after what you had told me previously was your father's hospitalization. Tell me a little bit about what happened there, what that experience was like for you, and what did it open your eyes to in the healthcare system that made you want to join Umbra?
Yeah, so my father is a senior. He's 80 years old. And last summer, he had a surgery that should have been routine and not a big deal. But he ended up getting a major infection throughout his body and had to be hospitalized for 8 weeks. And then he went into a sniff for 4 weeks after that. The challenge for us as a family is my mother passed several years ago, so she wasn't there to support him. And all of his children, all 4 of us, live in different cities, not anywhere near him, thousands of miles away from him. So, luckily, there's 4 of us. We were able to rotate through everything, but it really opened my eyes also for someone who had essentially a mistake and then a significant hospitalization, how important it is for there to be someone there literally every day at the hospital. We had situations where he actually was not given a medication that he needs for a neurological illness that he's had pretty much all of his life. And they couldn't figure out why he was tremoring, why he was having seizures. And we as the family had to actually go to the pharmacy, get a printout of the medications and go one by one through them with the nurse. And then they realized, oh no, we haven't been giving him that. It's well, that might be why he's having a seizure. They were thinking it was lots of other causes. So that, and even just when he was in the sniff, he went 6 days without getting a bath, and that was even with us asking every day, multiple times a day. So it really opened my eyes to how important it is to have someone there while a loved one is hospitalized, as what to advocate and to make sure that they're being given the best care possible. But then, of course, the transition is another big thing that was shocking to me. They typically, they tell you, we asked, can we have notice on
Mhm.
when the discharge is going to be? Do you have any idea? But that it never works that way, and I've learned that's very common. You usually find out the day before and often the day of. So as a family, we were scrambling to get in place all of the services that we would need so that he could go home, from in-home care to do meals for him to help him just with activities of daily life. So that process was very rushed and stressful, and we had certainly never contracted those services before, so we didn't even know what we needed, how to interview those people, and how to get them into place. So at the same time, I was speaking with my colleague who founded Umbra Health Advocacy, and she was telling me about the patient advocate industry. And it really opened my eyes that this is something that everyone needs. Patient advocates are truly experts in healthcare, and they've gotten in home care services dozens of times for clients or helped with hospital discharges. And they really know how to do the process and can provide support so that a family can get the right care in place.
You said a few things there that started getting my mind going about experiences that I've had or I've even heard of. I mean, I was recently in the hospital because I had my second child, and through the sheer exhaustion that comes afterward, I remember still having to have the clarity that I needed certain medications every morning that I was there. They hand you that little cup of just
Uh,
various pills, and you just assume, okay, they're giving me everything that I
mm,
need. So I can't even imagine in your father's experience having to just have the mental wherewithal to keep track of those things. And then you had mentioned with discharge, you have 24 hours to interview people who are going to be in your loved one's home and caring for them. And there's a level of trust there that you have to establish as well. So I can't even imagine how difficult that must be. And I know, a lot of people listening are probably in similar situations. Either they're caring for a parent or another loved one. So many of us are the sandwich generation, we're taking care of the older and the younger. So we're doing that while working part or full time. When you're looking back on this, what would you say was the hardest part that really drew you to the connection with Umbra?
Yeah, so I would say the hardest part was that everything was new. We had never done this before. I didn't know the difference between Medicare, Medicare Advantage plans. I didn't know what the benefits covered. I didn't know that, Medicare covered 21 days in a sniff and then after that you pay. So a lot of it was just the unknown was really the hardest part and trying to navigate it typically with at the time very short timelines. We for the discharge from the sniff, my we were told the day of that he and
Mm,
that is it's a very open-ended thing, and they take it day by day based on how they're progressing and their status. So we didn't have time to plan, and then to the hardest part was really trying to go out there and put everything in place when you don't even know what are the things that you need to have
yeah.
in place, let alone how to interview an in-home care aid or agency or anything like that. So I think the hardest part really was just trying to do this at such a rapid pace when we'd never done it before. And then fortunately, my employer did provide a lot of flexibility in terms of time and ability to work out on my father's in Oregon, the ability to work from Oregon while I was also trying to manage all this care. And then we also had an ability to roll over all of our sick time. And I had been there for 5 years, so I had a lot of sick time. So I was also able to take a lot of paid time off in order to provide the care. But yeah, I would say the hardest thing is just trying to rapidly put in place care to take care of a very sick loved one when you don't have any idea what you need.
And it's hard enough to figure out your own health insurance. So then trying
Yes.
to figure out your father's, for example, what's eligible, what isn't, if the
Mhm.
care providers that you're researching will be covered or not. And if it is not, what are those expenses going to be? There's so many layers to it. And I can't even imagine
Exactly.
how difficult it becomes. So that's where Umbra comes in, for example. So tell me more about what the company does,
Exactly.
how it's filling these gaps.
Yeah. So we're a patient advocacy services company, and patient advocacy as a profession is very broad. And people who are even credentialed, board certified patient advocates, which is a credential and a test that people can take, can include people with a variety of expertise. And so our services also are broad like that. We have people who have very deep health insurance experience, specifically Medicare experience, people who actually worked for Medicare for 10 or 15 years. And so they can do things like help you select the right Medicare plan, help you understand what benefits, what's covered, what's not covered. They can also help you with the more complicated things, such as appealing a health insurance claim denial. So if your health insurance, whether that's Medicare or private care like Blue Cross Blue Shield, denies coverage of one of your claims or one of your treatments, our advocates are very skilled and knowledgeable. What do you need to do to appeal? What are the right things to say? What are the documents you need to have in place? And can be very successful with that. So we have a lot of people sort of more on the health insurance side with that kind of expertise, also the medical billing side. So you can appeal medical billing errors, you can negotiate rates, you can negotiate payments, things like that. But then also people who call themselves patient advocates, we also have people who have very deep clinical expertise. So, for example, if you were diagnosed with stage 4 pancreatic cancer, you probably don't know anyone who had, you don't know anything about pancreatic cancer. We have people who are MDs and RNs who specialize in cancer or even in pancreatic cancer can give you the information about what to expect, can help you ask the right questions of your doctor, can sort of review the tests that have been done and perhaps suggest, commonly people with this kind of cancer get these type of tests. It doesn't look like you had that. So why don't you ask your doctor, why they decided not to do that test? So really someone who can walk side by side with you that has deep expertise has helped many people, often a survivor of the cancer themselves, and can really help you get the care that you deserve and ask all the right questions. Because frankly, right these days, doctors are so pressured for time that you don't get a lot of time with your doctor. And even though they want the best for you and to have you get healthy, they're pressured to kind of move on to the next patient. Plus, we
Right.
also know that some doctors are better communicators than others. And so, advocates really, a lot of the reason why people go into advocacy is because they are good communicators and they have that clinical expertise and they can interpret it. And then the other big area where we really help is in the senior care space. So, as you mentioned, many of us are part of the sandwich generation. We're caring for children still, but now we have aging parents who can't manage all their healthcare and their affairs on their own. And so, how Ember can help is we can do everything from becoming your loved one's healthcare manager, where we help manage appointments. Maybe we even attend appointments, give a report back to the family on what's happening and what the next steps are. We can work with the senior to make sure they actually go to that cardiologist appointment they were supposed to do, or they actually do the physical therapy that they were supposed to do. Or we can be a little more hands off, so that would be a more hands on senior care example. We could be more hands off where, okay, your mother is about to discharge from a hospital. We can help you rapidly find, assisted living facility or a nursing home, or help you, hire and put in place all the in-home care you would need, help you get grab bars set up and, make the house ready for the situation that your loved one's still in. So really patient advocacy is very broad. We have an expert that can probably help you with any healthcare problem that you have. And we were definitely seeing a lot of traction on the caregiving side because, and now as the baby boomers are almost all 65 plus, obviously a very big generation. So lots of us have parents in that generation are caring for them. And, and then, millennials also, their parents are aging, but they still have
Mhm.
children. So a lot of the support on the caregiving side we're seeing is growing a lot.
It's nice to be able to go to one place and access everything that you need. It allows you, I think, to focus on your health, to focus on caring for your loved one in the best way that you can, or even just being present because you're not spending all of that time trying to Google health questions that they have or send
Right.
messages through their patient portal to try to get in touch with the doctor and hope that you'll hear back in a couple of days. And that question
Hmm.
is so very specific that only that doctor can answer.
Yeah.
Um, we all have this terrible habit of Googling health
Yes,
conditions and
so
then
Dr. Google, yeah, and AI is piling onto that as well.
exactly. So, because you, have experienced this yourself and are so entrenched with growing this company, I imagine that you have seen or heard of an example of, a time that this any of these offerings have really changed the trajectory or outcome or what success looks like for a family. I'd love to hear any stories that you have.
Yeah, so I think some of the most impactful stories are often we have quite a few clients who have children that have either that are teenagers or actually grown, like or young people in their 20s that have mental health issues and have just been they've been trying to treat it their entire life and they're just not finding the right facility. And so we often get contacted when those children or young adults are in a facility that is a terrible fit for them, and
Right.
they're they're actually the facility wants to discharge them because they're violent or they're not. So we had particularly one family that had tried many different facilities for their 23-year-old son, and just really couldn't find the right facility. But we have a number of wonderful advocates that are very have a lot of mental health experience, a lot of experience with different facilities, and they were actually able to find him more of like a group home situation that he's thriving in. And now he has a life. He has a part-time job. He's not going from facility to facility. He's been able to get with the right physicians to manage his moods and his medication. And I think the the main thing with that is just not only the advocate have the experience, but the advocates spend a lot more time than a doctor can.
Right.
And so really listening and asking questions and being curious about a situation. And so I think some of those mental health ones have been super dramatic. I know for my family, we got a patient advocate in place. For us, it's a game changer because of the peace of mind we have. As I mentioned, my father lives in Oregon. All of us children, we live in New York, Seattle, Boston, Arizona. Like, we're not nearby. So the wonderful thing about our patient advocate is that she can go to the appointments with my dad. And certain days he's on it. Like, I went to a cardiologist appointment when I was visiting him, and he got he takes a lot of medications. He got like all 8 medications exactly right. But then there's certain days where he's not on it, where he's got brain fog and he's not on it. So
Yeah.
it's been a peace of mind for us to have an advocate go to the appointments, can report back to us what's going on, and also, as I mentioned, make sure that he was prescribed PT, that he actually makes the appointment and he does the PT. That if he was supposed to go get a blood test 3 weeks later, that he actually goes and does it. And so for us, that's given us a lot of peace of mind because while when he was hospitalized, we could rotate through, every couple of weeks we'd rotate a different sibling. We can't do that forever, right? We're
Right.
all working and we all have children. So so for me, it's a peace of mind. It allows him a lot. He is in assisted living now, so he has more support, but it allows, just like a hospital, though, you have to monitor the assisted living. Assisted living essentially is just that you live with other people and they have common meals. They don't provide a ton of services, right? If you need a lot of services, then you really need to be in a nursing home. So,
Right.
by having a patient advocate, we have peace of mind, but also it allows him to be a lot more independent and he didn't have to move to live near one of us or anything like that, which he definitely didn't want to do. He wanted to stay in his hometown. So,
Yeah.
um,
Yeah. I have a grandfather like that. He just wants to be his own guy, and I get it. It's hard to live your whole life independently and then have to rely on other people,
mhm,
and even if you have a handful of children who can help out, it's not necessarily like it's always predictable. Like you mentioned, like being in the hospital, it was more of like a schedule. Like, okay, these are the days we're going to
yeah,
meet with this specialist, and I can take off this week. Can you take off next week? But when you have a doctor's appointment or even like an impromptu, like he's sick and needs to go see someone, having
mhm,
that advocate there is huge. And I'm
yeah,
glad that you shared the story about the teen as well, because I think a lot of times people assume when we talk about caregiving, we're thinking about older generations, but we know that caregiving takes so many different forms, and because every family is different.
yes. Yeah, and then, we definitely part of our practice, we help a lot of people with disabled children, or that have a rare or very complex disease to help navigate, find the right specialists for that specific condition, and help them get in and get appointments and the right tests and things like that.
It's fantastic. One thing that you had also mentioned was working schedules. And I know that before we've talked about the statistic that 60% of caregivers are also working full time. You've lived that reality.
Hmm.
And we talked a little bit about the strain, about what that looks like at home, but tell me more about what that looks like at work. I know that when
Hmm.
we talk about employee benefits and work life balance and the fact that we've seen a huge spike in caregiver stipends, for example, year over year, there's
Hmm.
clearly something happening here where these two worlds, work and life, are blending.
Yes. Yeah, so I think the caregiving, particularly for seniors, has been sort of a hidden stressor that people weren't necessarily aware was happening. But as I mentioned, a lot of times when you're caregiving for a senior, or even if you're not formally caregiving, like you're not going and making them dinner every, like I don't go and make dinner every day for my dad, but I do. He can't supervise all of his needs on his own, so I do provide a lot of that support, and I do all of his financial stuff as well. But as I mentioned, like this stuff usually happens as an emergency, right?
Yeah.
So if you're working full time, it's not like you can be like, I'm going to take this week off to figure out my dad's discharge. You may find out late at night that your father was hospitalized. You've got to run, maybe you run, right, to do to be at the hospital, and you have vacation time or pay time off of some kind to go. But even in those cases, you're googling, you're trying to figure out, discharge planning. I want to go to assisted living? And so, we kind of talk about people at lunchtime basically spending their entire lunchtime googling, nursing homes, or even if you have already in-home care in place, often you have to change. The providers aren't providing the right service, you have to change. So what ends up happening is people are spending their lunch and their breaks, and probably even work time if they have a computer type job, googling, searching, trying to find all these resources. And that obviously reduces productivity. It causes a lot of stress because, again, you're trying to do work that you aren't an expert in. You don't have
Hmm.
any. Most of us only really do this once or twice because we only have one or two parents. And um so you're totally new to it. You don't even know what the difference is between assisted living, independent living, and a nursing home.
Right.
So yeah, so I think it causes a lot of stress, and it also reduces productivity. And of course, you're also in the emotional space of being worried about your loved one who's not doing well while trying to, get care in place. And so I think that is where also patient advocacy can provide the support, in that, there's deep expertise. There's already a lot of the services that you're looking for have already been vetted by that advocate. They know kind of the ones that get the best ratings, the ones that don't. And also just having someone by your side that knows more, even if you just want to use them as a sounding board of, we narrow down the list to these three, and this is what I'm thinking. They can, ask you some questions to make sure that those facilities or those options are really the best options for your situation.
Sure. And, we've talked about this a little bit from the individual, the employee perspective. What does this look like for employers? As you're helping grow this business, I imagine that there's some kind of work that you're doing there to help them, get it. Like there's a business case here.
Yeah.
Unfortunately, it always comes down to the ROI of stuff. Tell me
Yeah.
more about that.
Yeah, so the most recent AARP, National Caregiving Alliance study for 2025 shows that caregivers spend on average 26 hours a week providing caregiving, and that's just the average. So I think that's pretty eye opening for employers. And you had quoted the 60% are working. Actually, the most recent survey shows it's now 70% of the people providing caregiving are working.
Wow.
So, and then we also know, if you think about the lifetime of a person, 80% of people will be a caregiver at some point in their life. So whether that's for children, of course, is a big part of it, but or for your parents or some other, disabled or older loved one. So your workforce has a lot of caregivers, and I think because we've made so much progress in terms of childcare and supporting people to have families, and that's been a big focus, which completely makes sense. I think we haven't talked as much about for seniors and for the caregiving portion. And as you mentioned, we're seeing more and more employers being asked for that type of support for their employees,
Hmm.
observing that lots of employees are having these experiences, and we get contacted all the time from employers looking for solutions, whether their employees are asking for it or they're just noticing that, I think it's something like 50% of people that provide senior care, caregiving, have to take time off of work. So they start to notice people are using PTO for caregiving, if they're even telling the employer really. Like sometimes some of us just do it and no one really knows, what we're doing. They think we're on vacation, right? Um,
Right.
yeah, so I think that just knowing that 80% of the people on your team will at some point need to be a caregiver, and the majority of the caregivers are still working. Like some people think of it, oh, it's for seniors, it's the retired adult child of, someone who's like 95 or 85 or whatever. It's not. I mean, for the most part, especially since children, this last generation, people had children later in life. I am still in my prime working years and I have an 80-year-old father. So the majority of people providing this type of caregiving are employed and working.
And I mean, we talked about caregivers a lot in our conversation, but you can use these services for yourself too. And
Right,
I
correct.
yeah, and there's
Yeah.
so much confusion around health insurance alone, and trying to navigate what is available, what's covered, if you have an EAP at your company, if you're in a situation where you need a patient advocate and maybe one that is outside of the network that you've been using, because
Mhm.
maybe you haven't been hospitalized and that hospital network isn't providing someone for you, but this is just something else that you need help with. That's something that Umbra can do.
Yeah, and we can work. So when we work with employers, we become experts in whatever benefits they have, and that includes both the health insurance as well as EAPs. So
Mhm.
that's another way we help employers. We can help HR departments, especially if you're overworked and understaffed. We can help by being people that can answer questions about the benefits, can explain the health insurance, can explain maybe what they need to do to get a pre-authorization for a certain treatment or to go out of network or whatever, as well as what services, you get 3 or 5 mental health visits through your EAP. You should use those.
Mm,
So we can help a lot with that. And then if it's just the individual, we do have a lot of individuals who might contact us because they just don't really want their employer to know anything about what the issue is that they have.
sure.
And also, frankly, a lot of the work that our health insurance advocates do is fighting against a health insurance company to pay a bill or to cover something.
Yep.
So, it's important, you can't have someone who's working for the health insurer doing that because they have different incentives than just a totally independent person who works for you.
Of course. I totally get that. You had also mentioned before, since we're talking about insurance, that Umbra is expanding Medicare coverage across the country, which I imagine is a huge deal. Why does this matter for families?
Yeah, so this is really exciting. So in 2024, Medicare approved a bunch of reimbursement codes for patient advocacy services. So, helping people navigate healthcare, actually, even helping people navigate barriers to healthcare like food, transportation, housing. And what that means is that Umbra is one of the only companies, there's one other company I'm aware of that is set up now to bill Medicare. And so that means that if you have Medicare or if you're helping a senior that has Medicare, they can use their Medicare to cover our services. So our services would be essentially free, or if you have a co-insurance or a copay that you normally pay, then you would just pay that. And that opens up the services to a lot of people because this patient advocacy is a profession. They're paid
Mhm.
just like a lawyer, accountant, etc. But in this case, you can use Medicare to pay for it, and that we're excited about that. We're in 20 states right now, and adding 5 new states every couple of weeks. So we should be nationwide by the end of the year.
That's amazing. It makes it so much more accessible for everyone. Because I
Yes.
think one thing that is on a lot of people's mind, whether they are heading toward retirement, trying to plan for retirement, post retirement, is health insurance. I mean, it's a conversation I have with my mom all the time where she's like, well, I want to make it a few more years because I'm worried about how much money that I'll have for health insurance because my coverage is really good right now and I don't want to lose that, but I would like to retire.
Yeah, well, so there's Medicare. Once you hit at 65, you're eligible for Medicare. And there's lots of different options. I mean, there's many different plans you can choose from. And that can also be really confusing because which one is right, it really highly dependent on your health and the services that you believe you're going to need to access.
Yep. So you had mentioned that by the end of this year, you'll likely be in all states for Medicare coverage in
Yeah.
particular. But what does the trajectory of Umbra look like? I mean, the next couple years, 5 years from now, what are you hoping to see as it relates to the company growth, but then also maybe what workplace caregiving support looks like in general?
Yeah, so I mean, we're excited about Medicare. We know that's going to fuel a lot of growth and it's going to increase access. And we'll be looking at other payers, whether that's private insurance or Medicaid options as well. But the part that I am actually more interested in or hoping to grow is that employer benefit. And I know you all recently put out a study around how the amount of caregiving benefits has increased, but it's still a very small percentage of companies that are offering it. And so I
Right.
think that's where I'm excited to see awareness grow that not only is this a challenge and a need, but that there are actually solutions and services that can help people with it. Because as I mentioned, I think people have been doing this for a long time. They just sort of are doing it quietly, during lunch or nights and weekends. And I think just having it come out more as another example of a work life balance issue, a stressor that employees might face, and that there are some really great solutions for both the employer and the employee in terms of services like ours. And obviously there's other services that can help you find long term care facilities or uh, actually sell you the health insurance and things like that. But I think there's a lot of opportunities to support caregivers, and it's not necessarily that expensive for the employer. It's just surfacing the opportunities and making sure that your employees are aware that they exist.
Right. Now, what would have made your own experience easier? I know we talked about some of the hurdles in the last minute discharge and what to anticipate and interviewing caregivers or advocates or people that can just help out on a day-to-day basis. But is there something else looking back or even what you're currently still dealing with that might resonate with someone who's listening?
Yeah, so I think some of it is better planning. And
Mm,
sometimes that's hard when your loved one is super independent, they don't want your help, things like that. But there are some basic things that I think people can do if they do have elderly parents, even if you're not caregiving right now. Certain things like access to their medical records. So, well, first you get a power of attorney and a healthcare proxy, and it's important to get those in place sooner rather than later because you getting that in place when you're dealing with a hospitalization or even if your loved one's not is incapacitated and can't sign a POA, you can't get a POA if you do that. So
yeah.
basically a power of attorney is just going to allow you to make decisions if your parent can't. And a lot of times that's more financial, property decisions, things like that, versus the healthcare proxy allows you to make medical decisions. So I think first, like talking to an elder lawyer, getting that kind of stuff in place because um, a lot of people don't do it until it's an emergency and then it's a whole thing and the hospital won't talk to you, the bank won't talk, and no one will talk to you because you don't have authorization. So I think just having those in place even if you're not using it is important. Fortunately we did actually have that stuff in place. The things that we didn't have in place were you can get access to your loved one's medical records whether you have the POA or healthcare proxy just by having them add you to their Epic or MyChart account.
Yep.
So that I found, and we did that actually after my father discharged and was, at home and then in assisted living. But what's great about that is I can see what appointments he has. I can see the doctor's notes after the appointments. I can see what they've said he needs to do next, whether it's a blood test or a cardiologist appointment or whatever. And so I think just getting that set up, even if you're not using it, but having it set up because the patient, my father, has to like grant the access. So if he's hospitalized and unable to do that, well, then I can't get in. So having some things like that set up. Also, as I mentioned, medication lists. So
Mm,
even though you have access to the Epic, either your loved one or you need to keep the medication list updated in that platform so that it's correct, or you need to on the side get the medication. You need to get all the medication lists and all of the medical conditions your loved one's being treated for. So, for example, my father, I guess 13 years ago, he was diagnosed with a heart disease or whatever, but it wasn't anything. They wasn't even taking medication for it. It wasn't any big thing. But we did not like we as the sibling as the children went, and we had no idea that this had happened. So also just like documenting from your loved one, like what are the conditions they're being treated for, who are all their doctors if it's not an epic, because also if they have multiple my charts from different hospitals, it may not all be consolidated. So really
Yeah.
just getting all that basic medical information together so that if there is an emergency, then you have it and you know. And then also importantly, every few months, just checking in and updating it because elderly people, their medication and their doctors and their conditions change pretty rapidly. So I think just some planning ahead so that you have the things at your fingerprint or at your fingertips, and you're not like we had to, basically the best source of medications for my dad was to go to the pharmacist and ask them to download a list like that. That it took a couple days before we figured out, okay, that's what we need to do. So
Hmm.
just having all the information, even if you're not using it for anything now, is important for when you get into those emergency situations.
Yeah, it's funny. There are so many instances in my life where I've gone to the doctor, just even for a regular checkup, and you have to establish like a new patient
Record, yeah.
record. Um, and they ask about family history, and I sit there like, oh no,
Yeah.
now I got to figure that out. I
Just if
remember
your
certain
parents are
things.
anything like mine, they're not really forthright on all of their aches and
No,
pains and their illnesses. And especially I think for my dad, since this heart disease wasn't a major thing he was being treated for, it was just something they were watching. We had no idea, but it does matter in terms of giving a full picture to a new doctor.
that's so funny because there are so many times my brother and I have been group texted by either one of our parents saying, "Don't freak out. I was in the hospital, but I'm fine."
Right.
And what
Yeah.
and then they tell you after the fact. So I think really
Yeah.
this comes down to be proactive. Talk about your health with your family,
Right.
because it's gonna matter at some point.
Yeah. Yeah.
Jennifer, thank you for your time. I appreciate it.
Thanks so much for having me. And I hope everyone is well and can access the healthcare they need.
Thanks for joining us on Getting Personal, brought to you by lifestyle benefits experts at Compt. Remember, you can always find more stories and helpful insights on our LinkedIn and blog.